Okay, we're going to demonstrate hand washing. I'm going to turn the faucet on. And get the water nice and warm. You don't want it too hot or too cold. And we're going to just wet our hands first. And we're going to be careful not to touch the ball of the thing. Hold on, let me just... Okay, that's nice and warm now. Alright, so we're going to wet the hands. And then we're going to get some soap, about a teaspoon. And we're going to lather our hands very nice, using circular motions. Make sure to get in all the crevices where bacteria likes to hide. Being careful not to touch the bowl of the sink so our hands won't become contaminated. And we're going to get our thumbs. On the tops of the hands. Again, using circular motions. Lather. And we're going to wash each of our fingers individually. And we're going to wash the hands for 20 seconds. We're going to get in between the crevices. I'm going to dry knuckles. Again, circular motion. And our fingernails. Get all that dirt and bacteria out from under your fingernails. And make sure to wash all the way up past our wrist. And then now we're going to rinse. And let the water drip down. Careful not to let our hands touch the bottom of the sink. Let the water just drip from our hands. And you gotta take a towel. And dry our hands thoroughly. And throw that away, and then we'll use a second towel. To turn off the sink. Okay. Hello.
Hi.
My name is Tiffany. I'm going to be your nurse today, and I need to perform a head-to-toe assessment. Is that okay with you?
Yes.
Okay, great. Okay. Just gonna close the door. Okay.
John Smith, March 16, 1969.
Okay, and what would you like me to call you? John, Mr.
John's
Smith?
fine.
John's fine? Okay, do you know where you are?
Yeah, the hospital.
Okay, and what month is it?
In November
What year is it?
2024.
And who's the president?
Joe Biden.
And what season is it?
Oh, fall.
Fall. Okay. So he answered all my questions correctly. He's alert and oriented ×4. Do you have any allergies?
No.
Okay. Now I would obtain the patient's height and weight and his vital signs, which I'm going to do now. I'm going to take your blood pressure. Is this arm okay?
Yep.
Okay. Now on a scale of 0 to 10, are you in any pain today?
No.
No. I'm just going to pull your sleeve up a little bit. Okay, you can put your arm down. Sorry about that. There. Okay. Okay. Okay, 124/72. That's good. Okay, just take this off. Okay. Okay, I'm gonna get your O2 stats. I'm gonna give you a finger. You can just rest that right there. I'm gonna just get your temperature. 98.9. Good. I'm just gonna set your pulse. Okay, heart rate 72, respiratory rate is 18, and your pulse saturation was 99, which they're all within normal limits. Okay, so next I'm gonna have you remember 3 words for the exam, which is horse, mountain, and cupcake. Okay, so remember those 3 words. Okay. So next we're gonna start with the head, and we're gonna look for his color of his face, and it's nice and pink in color, which it should be. And then next we're going to assess the size of the head. It should be in proportion in relation to the body, which it is. It should be symmetrical, no facial drooping, no involuntary movements of the no involuntary movements or shaking of the head. And then next we would inspect the head, the hair. I would put on gloves for this to go through his hair. What we'd be looking for is any infestations, any redness, or swelling of the scalp, any scars, any wounds, any lesions, and there doesn't appear to be any, no infestations. And then we would look in the back of the head for any pressure injuries in the back of the head. And I don't see any here. Very good. Okay, everything looks good. There's no scars, no lesions, no wounds, no surgical incisions, no pressure injuries in the back of his head. Next, we would inspect the eyes, and what we would be looking for is the sclera first. Make sure it's nice and white and shiny, which they are. There should be no yellowing, no redness of the eyes, and but actually before the eyes, we would take out my gloves and wash my hands. So then we inspect the eyes for the sclera, the white and shiny, which they are. And the next, I'm going to assess the conjunctiva. So I'm going to have you look up, John. And I'm just going to pull your eyelids down gently, and we're going to look at the conjunctiva, make sure it's pink and moist, no drainage, which there isn't. Very good. So next we're going to assess the pupil size, and I'm just going to have you look straight ahead, and we're going to check your pupil size. And they're 4 millimeters. The normal is 3 to 5 millimeters in size. Okay, the next I'm going to assess cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens nerve. And what I'm going to do is I'm going to have you follow my pen light, but only move your eyes and follow the pen. Don't move your head. Try to keep it still, okay? Okay, and these cranial nerves are intact. No involuntary shaking of the eyes, no eyes going from one side to the other. And so next we're going to do accommodation, which is I'm going to put my pen to your nose, and you're just going to follow my pen light to your nose. And this tests cranial nerve 3, the oculomotor nerve. All right, so you just follow my light with your eyes, and they accommodate bilaterally. So this cranial nerve is intact. Next, I'm going to assess the pupillary reaction to light, which is cranial nerve 3, the oculomotor nerve again. So I'm just going to have you look straight ahead, and I'm going to shine a light in your eyes just for a couple of seconds, okay, just to see if your pupils constrict, okay, which this is what they should do. Okay, and the pupils constricted, equal and round and reactive to light. Very good. Okay, next we are going to assess the ears. First, we're going to inspect the ears. We're going to look for any redness on the pinna. Then we're going to look behind the ears and make sure there's no redness, no breakdown behind the ears. And there's no redness. Have you had any drainage in your ears? No? Okay. Next, I'm going to palpate the pinna. Any tenderness here?
No.
Okay. No masses, no lumps or abnormalities felt. Okay, next I'm going to look inside your ears, okay? I'm going to pull the pinna up and back and look inside for any drainage, any redness, any odor. There's none in that one. No redness, no drainage, no odor in that one either. Okay, now I'm gonna do the whisper test, which tests cranial nerve 8, the acoustic nerve. So I'm gonna have you stand up, and I'm gonna whisper 3 words. I'm gonna stand behind you and whisper 3 words, and I need you to repeat them back to me, okay?
Okay. Cat, apple, leaves. Cat, apple, leaves.
Okay, and this nerve is intact. Okay, next we're gonna assess the nose. First, we're gonna inspect the nose and make sure it's midline with the face, which it is. We're gonna check for any deviated septum. Make sure it's nice and midline. So, and then we're gonna look inside the ears and make sure there's no drainage, no redness. Okay, now you look up, John. I'm gonna look redness, polyps, draining. I don't see any. And the nares are nice and clear. And there's no deviated septum. Okay, next we're going to do a patency test on your nose. So I'm going to have you block one nostril, and then have you breathe out. And with the other one. That's good. Both nares are patent bilaterally, and airflow is coming out bilaterally. No obstruction. Okay, next we're gonna assess the mouth. And first we're gonna inspect the lips, make sure they're nice and pink and moist. Make sure there's no chapped lips, no sores, no lesions of the lips, and we don't see any, okay? And then next I'm gonna look inside your mouth, so I'm gonna have you open up, and I'm just gonna look inside. I'm gonna inspect the oral mucosa, the buccal mucosa, and making sure the membranes are nice and pink and moist, which I can see that they are. The tongue is nice and pink and moist. Teeth are intact. There's no sores or lesions of the mouth. Very good. Okay, now we're gonna test the cranial nerve 3. So I'm gonna have you frown and frown and raise your eyebrows. Good. Now we're gonna test cranial nerve 7. I'm gonna have you smile, puff out your cheeks. Very good. And then have you stick out your tongue and move it side to side. And this is cranial 12, the hypoglossal nerve, and all those nerves are intact. Okay, then next we're gonna do the neck. I'm gonna have you lift up your neck, and we're gonna inspect the neck. It should be nice and supple. Trachea should be midline. Any tenderness?
Nope.
No? No pain?
No pain.
And it appears to be midline, no masses or lumps or lesions. No scars, no bruising, no rashes, no swelling. Okay, good. Okay, now we're gonna assess your lymph nodes. So I'm gonna start with the preauriculars. I'm just gonna feel around in circular motion. Okay, and the postauriculars. And the occipital. And the parotid. Submandibular. Submental. Okay. Anterior cervical. And posterior cervical. And supraclavicular. I'm just gonna, is this okay if I go?
Okay.
Did you feel any tenderness?
No.
Any pain? No? Okay. All right, very good. Okay, now we're gonna test your arm strength. So what I'm gonna have you do is I'm gonna have you push up against my hands. Good. And then you're gonna push down. Very good. Okay, this muscle strength is a 5 against gravity and resistance. Good strength bilaterally. Okay, now I'm gonna have you do some range of motion. We're gonna test your shoulders, range of motion of your shoulders, your elbow, and your wrist. Okay, so starting with your right, we're gonna do some flexion. So you can lift your elbow up, and then extension, and then abduction. Abduction. Very good. Okay, now we're gonna do your elbow. We're gonna do flexion. Same arm. Yep. Flexion, extension. Okay, now the wrist. Flexion, extension, and hyperextension. Very good. Okay, now the other one. We're gonna do flexion, yep, extension, abduction, adduction. Very good. Okay, now the elbow. We're gonna flexion, extension. Good. And then the wrist. Flexion, extension, hyperextension. Very good. All right, so he's got full range of motion of his upper extremities, shoulder, elbow, wrist. And then we're gonna inspect the arms for any arm bruising, any scars, any swelling, any rashes. And we're gonna look at the elbows for any pressure injuries. No? And then I'm just gonna rotate your arms, see if we can feel for any crepitus. Okay. Now we're going to do the other one. Again, we're looking for any swelling, any rashes, bruising, scars, incisions. I don't see any. And then we're looking on the elbows for any pressure injuries, which she does not have any. Again, I'm going to rotate your arms. Okay, and I don't feel any crepitus. Very good. Okay, and now I'm going to have you squeeze my hands as hard as you can. Okay, good. Good strength equal bilaterally. Okay, now we're gonna move on to the respiratory system. So now we're gonna inspect, first we're gonna inspect the anterior chest. Just by looking at him, he doesn't appear to be in any acute respiratory distress. We're looking for any, his effort and rate of breathing. Is it shallow, rapid, or even? He appears to be, his chest is rise and fall symmetrically. On his chest, we would look for any wounds, any redness, any incisional scars, any possible swelling of the skin, any injuries, and there isn't any. And then next, we would palpate the chest, and we're gonna look for any lumps or masses. So I'm just gonna palpate your chest, okay? And just let me know if you feel any tenderness or any pain. Are you having any cough or shortness of breath today?
No.
It feels all okay?
Okay.
All right, good. All right, so I don't feel any masses or lumps or any of those things. Okay, now we're going to auscultate your lung sounds. And I'm just gonna have you take a deep breath in and out whenever I place my stethoscope, okay? So we're gonna start with the top of this clavicle. Okay, you can take a deep breath in and out. In and out. Deep breath in and out. We're going to compare one side with the other. Again. Okay. One more time. Very good. Okay. Now we're going to do the back of the chest. Back of the chest. Go ahead and turn this way. And on the back, we're going to do the same thing. We're just going to look for any wounds, any scars, any surgical incisions, any maybe redness of the skin, any pressure injuries on the back, maybe especially the lower back. And then we're going to test for any tactile firmness. So what I'm going to have you do is I'm going to have you say 99 every time you hear my hands, okay? Every time you feel my hands on you, okay?
Okay.
Go ahead.
99. 99. 99. 99. 99.
Very good. Okay. And then I'm just going to test your chest excursion, see if you breathe, when you breathe in and out, if your chest rises and falls. All right, take one deep breath in and out. Okay, one more time. Okay, as he breathes in and out, his lungs expand equally. Okay, now I'm going to listen to the back. I'm going to listen to your lung sounds in the back. Okay, deep breath in and out. In and out. Very good. Good. Yep. Deep breath in and out. Are you feeling dizzy at all?
No.
Okay. Deep breath in and out. Okay. Okay. Very good. Again. There. Okay, good. Lung sounds are clear in all four lobes. Okay, now we're going to go to the cardiovascular system. Are you experiencing any numbness or tingling in your body? No? Okay, so now we're going to assess for jugular vein distension. So I'm going to have you lay down. but not all the way. We're gonna have you at like a 45-degree angle. Okay, I'm gonna have you turn your head to your left. Okay, I'm gonna put your head back a little bit. And what we're looking for is just if for distension of the jugular vein, any increase, which would indicate increased signs of central venous pressure. And as you can see, his jugular vein is nice and flat, and there's no distension. Okay, you can come and sit. You experience any dizziness?
Nope.
No? Okay. Next, we're gonna do the heart sounds. So I'm gonna listen to your heart, okay?
Okay.
You don't have to, you can just breathe normally. Okay, we're gonna start with the aortic valve, which you'll find at the second intercostal space on the right side of the sternal border. And we're listening for S1 and S2. S2, the dub is loudest at the base of the heart. Very good. And then we're just going to go right over to the right sternal border, second intercostal space. And we're listening for the pulmonic valve, S1, S2. And the S2 is loudest here as well. And then next we go down to the third intercostal space. And this is the Erb's point, which is halfway between the base and the apex of the heart. And there's no specific valve here. We're just listening for S1 and S2. And then we go down to the fourth intercostal space. And this is the tricuspid valve. And again, listening for S1 and S2, lub dub. S1, the lub is louder here at the apex, towards the apex. And then we're going to go over to the fifth intercostal space, mid-clavicular line. And this is the mitral or bicuspid valve. And again, listening for S1 and S2. S1 is going to be loudest here at the apex of the heart. And this is also the point of maximal impulse, where we can assess the apical pulse. And normal apical pulse is 60 to 100 beats per minute, which I'm going to take down, okay? You feel okay?
Mm-hmm.
Okay, 75, really good. Nice. So his apical pulse is 75 and his heartbeat's nice and regular. Very strong sounding heart. Okay, so then now we're gonna go on to the GI system. When was your last bowel movement?
Yesterday.
Yesterday. And what color was the stool?
Brown.
Brown, good. Okay, and have you experienced any diarrhea or constipation?
No.
Any nausea or vomiting?
No.
No? Okay, so now I'm going to assess your abdomen and your bowel sounds. So I'm going to have you lay back down. Okay, I'm just going to have you pull your shirt up just a little bit, just enough to see you go. Maybe up a little bit more. Yeah, that's good. Okay, first we're going to inspect the abdomen. We're going to look for any distension, any maybe redness of the abdomen, of the skin, and make sure that it's you know, it's nice. This is nice and flat and symmetrical, which this is how it should be. Maybe look for any wounds, any surgical incisions, anything like that. Maybe any drains if the patient might have one. So up here, his is nice and flat and symmetrical. He's got no scars, no surgical incisions, and no swelling. Okay, so now we're gonna inspect your bowel sounds, okay? I'm just gonna listen to your bowel sounds. And first we're gonna start in the right lower quadrant. And we would listen for 1 full minute. And we should hear 5 to 30 clicks and gurgles. Okay, and then we go to the right upper quadrant. Okay, and then the left upper quadrant. And if you don't hear anything, you need to listen for a full 5 minutes. All right, we've got some activity. You feeling okay?
Mm.
Okay, and then left lower quadrant. Okay. Bowel sounds are active. Okay, next I'm gonna palpate your abdomen. And obviously you wanna always do this after auscultating because otherwise you stimulate the bowels. Okay, just let me know if you have any tenderness, okay?
Okay.
I'm just gonna feel for any masses, any lumps. Any pain?
No.
No? Does that feel okay?
Yeah.
Okay, very good. Okay, now we're gonna assess you. You can put your shirt down. Yep. Okay, I'm gonna assess your urinary system. I'm just gonna ask you a few questions. I don't really comfortable, but it's important. When did you last void?
This morning.
This morning. And what color was it?
Clear.
Any episodes of urgency or accidents?
No.
No. Any trouble or starting or stopping the stream?
No.
No. Any dribbling? Any pain during urination?
No.
No? Everything's good? Okay, good. Okay, so now we're gonna do the, I'm gonna come down to the feet. Okay, I'm just gonna fix your feet here in the blanket. Okay, I'm gonna come down the feet. We're gonna assess capillary refill on each toe. Make sure you got some good circulation. Okay, and capillary refill is less than 2 seconds. It's very good. And then we're going to do the pedal pulses. Okay, and pedal pulses are equal bilateral, positive pedal pulses. Okay, and I'm going to have you push up against my hands with your feet, okay? Okay, good, equal strength on bilateral. And then I'm going to have you raise one leg at a time. Very good. And the other one. Good. Okay. And I'm just gonna inspect your feet. We're gonna look for any signs of, maybe cyanosis, any pressure injuries. We're gonna look on the, especially on the heels, on the bottoms of the feet for any ulcers, like especially in people who are diabetic. We'll look for any ulcers. And then we'll look for any edema of the legs or the feet. Even for any, maybe surgical incisions, redness, swelling, any wounds. Same thing with this one. You're going to look on the bottoms of the feet. We're going to look on the heels for any pressure injuries and any edema of this foot. Because you want to look on both sides. Look for any redness, any swelling, any edema, any surgical incisions, any scars. His skin looks good. There's no redness. Nice. Okay, then I'm going to have you try to bend your knee against my resistance. Okay. And then this one. Very good. Okay. Okay, now I'm going to have you sit up over here. Okay. All right, now I'm going to have you walk to the door. I'm going to assess your balance, okay? And then walk towards me. Very good. His balance is nice and even. Good. Okay, now I'm going to have you, do you remember the 3 words that I said to you?
Yeah. Horse, mount, and cupcake.
Very good. Okay. Well, that concludes our exam. Do you need anything before I leave the room?
No.
No? Okay,
Thank
now
you.
I would document my findings, and I would wash my hands.